Hi everyone. I am Laura. I'm founder of Biohacking Safari. We've been curating the talks with biohackers and artists and entrepreneurs. This is Byron. Byron Rich is an artist. He also uses biology as a way to express himself. And we will soon have Mary, who is also a bioartist at MIT. And he's also from America, so North America.
Oh, I'm from Canada.
Oh, Canada.
Whoa!
I just live in the States.
And we have a discussion with Olivier, which is also a hacker from Paris. He will come on the discussion later. He will present his EcoPen, so he's doing more medical, technological open source. Oh, that's
Mary. So.
This is Mary.
Hey, Mary. Greetings. We're on, so I'll present and then we'll chat. Okay. Okay. Thank you. Oh yeah. All right. I'm good. Time for me to roll. All right. Thanks for having me. It's nice to be here. I'm a little jet lagged, so please forgive any oversights that I may or may not make. As Laurel said, I am indeed an artist. I'm not a biologist or anything like that. My big thing is kind of just technological and media criticality. So I'm a professor at a college just north of Pittsburgh. I've been teaching there for a couple of years now. And the project that Mary and I are working on is open source estrogen. And you can see it's called Housewives Making Drugs, which might seem like a provocative title. It's meant to be though, because it's just like a critical examination of the topic. So I am not, I look like I'm part of the patriarchy, but I don't agree with it. So don't hate on me too much as we discuss this. So that's me, that's Mary, and this is our project. So let's just move right into it. How are women like chickens? Like scientists who begin with a fundamental problem, we ask this simple question: how are women like chickens? And I know this seems crazy, but don't worry, I'll get to it. The question was inspired by the written text of cyberfeminist art collective Sub Rosa. So in their 2009 pamphlet, Cultures of Eugenics, they write that eggs are the production matrix, the womb the generator, the originator. Like nature's bioreactor, eggs perform as a manufacturing medium. They are a source of embryonic stem cells for transgenic production, for assisted reproductive technologies, and paradoxically acronymed as ART for art. So how this project kind of got started was, so Mary and I have been working on it for a few months together. A few years ago when I was in grad school, I moved to the States from Canada, and my girlfriend was telling me she wanted to go get a prescription for birth control, and I'm like, okay, that seems easy enough. And then she's like, no, it's not so easy. I have to go talk to my boss about it. I have to go through all these weird channels to get like funding via insurance. And I was like, that's crazy. You can't just go to the pharmacist and get birth control. This is super deranged. So that got the idea in my head, but I was not suited to execute it. So it sat on the back burner. Mary and I were in Finland this summer at Ars Bioarctica up in the Arctic, and we started chatting about this topic, and Mary's like, oh my gosh, we can totally do something with this. So then she's been driving this, actually seeing this come to fruition in a far more inclusive and much stronger way than I could have ever on my own. So the extraction and commodification of bioresources from women's bodies can be seen as a form of colonization. You can see here the cult of domesticity, or cult of true womanhood, was a prevailing value system among the upper and middle class during the 19th century in the US, especially in the US and Great Britain. This value system emphasized new ideas of femininity, the woman's role within the home, and the dynamics of work and family. True women, quote unquote, were supposed to possess 4 cardinal values, or virtues: plenty, purity, domesticity, and submissiveness. Although all women were supposed to emulate this ideal of femininity, Black, working class, and immigrant women were often excluded from the definition due to societal prejudice. So just to root this work, Semiotics of the Kitchen by Martha Rossler, and then you can see Martha Stewart over there from her cooking show. Then let's move along. So where should we go? Testo Junkie, of course, this wonderful book. So Fresnoye writes that his use of testosterones is a way of undergoing gender inscribed on the body by the capitalist commodification and mobilization of sexuality and reproduction. So hormones like estrogen and testosterone are a molecular prosthesis for our natural bodies. He says that this challenges the notion of natural, proclaims it as myth, rendered as a useless condition in our current biotechnological age, which he coins the pharmaco-pornographic regime. Oh, what a word. So, it's too much of a word for me. Then we'll just get into the trans-hack feminists. A gene punk collective originated in 2014, an eco-industrial post-capitalist colony in Spain. Their goals are to hack gender constructs and create liberating technologies in a DIY, DIWO fashion. Gene punk is an extreme and accurate gesture to detach our bodies from the compulsive dependency of the fossil structures of the hegemonic health system machine. That's not my quote, that's theirs, okay, so don't get on my case. So examples are the 3D printed speculum and DIY diagnosis of fluids. So there's another group out there right now, biohackers from Counterculture Labs and other Bay Area community labs are developing an open source insulin project. They're using a cloud-based synthetic biology laboratory called Arcutus Bio Cloud, which enables the team to design and prototype their organism's metabolic pathway. They recently launched a crowdfunding campaign on experiment.com. They say there is no generic insulin available on the market despite great demand in poorer communities and regions of the world. Meanwhile, pharmaceutical companies patent small modifications to previous insulins while withdrawing those previous versions from the market to keep prices up. So we're really into marginalization, especially being from the States. In the US, there's an enormous binary setup, especially like a male-female binary. I'm going to get into this a little bit more as we hit the philosophy. So here we go. Oh, you want to go back?
That was launched like Monday or Tuesday or something.
Yeah, it's just like the last couple days.
Yeah, it's big.
Totally. So let's get into a little philosophizing on the subject. I don't know how to say this dude's name. I'm a terrible French Canadian. I don't know if that's even a French name, but Kuni? Okay, we'll say that. We'll go with that. So as you guys all know, citizen science to some degree and the OS movement to a large degree asserts that open access is a kind of democratizer. Being that we're artists, we want to make sure that we're really critically examining these things. So again, sorry if this all sounds a little negative, but OSE critiques that the skills required to kind of get into this whole biohacking and open movement still requires esoteric knowledges. And I'm using knowledges, not knowledge, and you'll understand why in a bit. Access becomes limited and out of reach of marginalized groups. So in the US, African American women, for example, have far less access to education than almost any other group. They also have far less access to birth control. And that systemic marginalization really shows up as enormously higher rates of like single motherhood, for instance, a far larger, there's just a lot more kids born into poverty than should be in the United States. So that was one of the main goals of our project originally. So access becomes limited and out of reach of marginalized groups. As Hart and Negri contend, common knowledge of today is the foundation of all new knowledge production in the future. So what is common knowledge today, or what is esoteric knowledge today becomes common knowledge of the future. So is Brian Winston's notion of technologies all being evolutionary? That's kind of how we're looking at redefining the definition here a little bit. So let's move on into Marx. Always fun. So OSE wants to undermine entrenched notions of knowledge and reframe latent human capacities as traditional knowledges, liberating them from institutional and corporate control. So what we mean by that is if we can reframe the conversation and say that like hormonal production, something our body can naturally do, is actually a kind of knowledge, and we're packaging it as knowledge is, then maybe we can redefine the conversation a little bit and say, let's move it out of this like corporatized sphere and move it into making it much more accessible. The reason why we're doing this now, it moved beyond just like trying to provide birth control, and now it's really moved into wanting to provide access to hormone therapy for the trans community, especially in the US where it's incredibly difficult to actually get the money to make it happen. So let's move down. So a major critique of contemporary ideas around bioproperty claim, as Hart and Negri contend, the privatization of knowledges and entrenchment of what is considered traditional or latent runs counter to social good. Privatization limits conversation and is driven by profit margins, further marginalizing those on the periphery of what's called normalcy in the United States. So if hormone production could be reframed, then could access be widened for uses in hormone therapy and birth control? We must really ask, as Marx suggests, how can latent processes and knowledges be monetized morally? Only via framing them within the confines of specialized tools and esoteric language. So the only way that we can really monetize latent knowledges is by making specialized tools and making college cost so much money that people can't afford to go to it. Okay, we can't actually monetize a natural process. Well, we can, obviously, we've seen, but we shouldn't. So such specialization is a marginalizing, normalizing force. So then we get into my dude, Tour. He postulates that the modern perspective is one of what he calls an asymmetrical epistemological process known as purification. Some of you guys have probably heard of this. Eugene Thacker describes it as a system whereby a binary exists in knowledge and innovation. For example, human and machine, self-other. Purification is obvious when we look at contemporary social norms. Binaries are enforced and held as rule. Purification is the predominant paradigm. Latour's hybridization, however, goes beyond this idea. A hybrid, as Thacker describes it, is a heterogeneous collectivity, interstitially constituted by mediation. Oh, and we'd argue reflexiveness, so being self-aware. In Thacker's Global Genome, he says, hybrids become mediators, actors endowed with the capacity to translate what they transport, to redefine it, redeploy it, and betray it. The rebetray it, or the betray it part, is really important to us because our whole project is kind of predicated on the idea that we can democratize access to hormones, which is not true at all, because, like we were just talking about a minute ago, it still requires this super esoteric knowledge to actually employ. So unless access to education is better, then this whole thing is just self-defeating. So we're purposely making something that is going to fail to a degree in terms of social good. And that's by design. So that's one of our big critiques of this whole thing. We're just going to move right into, we might even not look at Foucault too much. But Foucault contends that, pardon me, speed it up.
Yeah,
okay.
Sorry.
No, it's all good. You guys can ask me about Foucault and how so boring. How it's a surveillance technology. So let's look at the methods. But keep in mind the surveillance technology. Biotech is a surveillance technology. So method number 00, this is where we really got started and where we've kind of based this whole kitchen-based motif of the project. Organic chemistry. So trying to isolate cholesterol from an egg yolk and then from there, actually build the hormones that we want. So at the initial stage, we thought the analogy of women and chickens could be biologically represented by the biosynthesis of estrogen from cholesterol via the egg yolk. This reaction is actually carried out through a series of enzymes requiring the machinery of organisms. Super complicated, and we're battling away at it. I should say Mary is battling away at it. Because she's a champ. Method number 1, synthetic biology. So designing organisms to be drug factories. For example, using the organism yeast as the chassis, quote unquote, knock in 5 genes for enzymatic reaction to go from cholesterol to estrogen. Here you can see how that all occurs. I don't know what any of that means. I'm glad that Mary does. Metabolic pathway for steroid hormone biosynthesis, yada, yada, yada. And then method number 2, agrobacterium-mediated transformation in plants. So Ryan Hammond, another artist, I don't know if that's how you're going to be coined, is actually working on this in the States. But he's running into some major roadblocks as it's actually very difficult. It just takes so many generations to actually get a result, and that's the big roadblock. So we've got a 3-pronged system right now, and we're investigating which is going to actually get this to, I hesitate to use the word market because that sounds so capitalist, but I will for this, to market quickest. We'll probably want to see all of them through just because that's the right thing to do. And then method number 3, we've got 4, right? I forgot Mary added this one in. Extraction of phytoestrogens. So phytoestrogens are plant compounds. They can bind to estrogen receptor sites. They are widely found in nature but have very weak estrogenic activities and do not interfere with normal hormone activity in the body. So something else that we're working on is the environmental ramifications of so much estrogen being out there in the world via the pill and being peed out constantly. So this is just a little slide that Mary made up. Estrogen extraction, body equals urine, ecology equals water, eco bodies. So let's just, because we only have 30 seconds. Open source estrogen, 2 minutes. 2 minutes, okay, 2 minutes. Estrogen does not only consider humans, but also our shared environment. As we perform estrogen synthesis, we should be aware of the effects of estrogen leaking into the environment and what kinds of detection and extraction methods can we mobilize to the public. So this is something that we're going to be really pursuing next year. So male frogs, here you can see all these like wildly, blown up claims. Male frogs may be turning female thanks to estrogen in suburban waste. Oh, suburban lifestyle, the worst. Collapse of a fish population after exposure to a synthetic estrogen. So these are some of the environmental headlines that you'll see. So our goals for the project, let's just recap those. Create a DIY open source recipe for estrogen synthesis. Contextualize the recipe in a video performance piece in the form of like a Martha Stewart, Julia Child style cooking show. So we've already done a little version of this that if we have time later on or something, I can show you the video. It's just up on Vimeo and stuff. We've been using it to try to get some money flowing for this project because it's expensive. And then generate discussion about how the control over female and trans bodies exercised by governments and biotechnical institutions. So we really want to critique how body sovereignty isn't it a corporate issue to a large degree and a much more systemic issue than we tend to ponder. So, we're copyleft users who consider sex hormones free and open biocodes, whose use shouldn't be regulated by the state or commandeered by pharmaceutical companies. So this is out of the book Testo Junkies, which I highly recommend. I just picked it up a couple weeks ago, and yeah, it's wonderful. Contact info, you can get Mary. She's the one to ask the tough questions. You can ask me the philosophy. You can also ask her the philosophy, but the real tough stuff, send it to her. Sorry, Mary. That's her website. This is my website. You can get me there. This is Allegheny College is where I teach. If you don't like what I've talked, send an email to the provost there, and they will do nothing. Thank you very much.
Not the internet, just the internet. She's still on my
Yeah, she's good. So we'll leave this here and muted. My computer has met the end of its lifespan, so it has to be plugged in. Pardon me? Can't do anything. It's just. Oh, to change the battery. Yeah, I'm gonna do that, but it just happened on the flight, so that it's no longer operating.
Okay, hi everyone, thanks for having me today. So I have 12 minutes. Yes, explain about this e-open project.
So we have time for questions.
So we are both a project in an open community, and we are working at making open and fully available medical imaging technologies for anyone interested in it. This is about who we are, like old folks trying to do our best with new technologies. Let's be concrete. Our objective is, as you see on the screen, it's to prototype by February the 17th for the true anniversary of the creation of the stethoscope by Dailly, to create an eco-stethoscope, which is a device like an ultrasound probe that you can connect to your smartphone, that you use as a display to explore inside the body. Why? To transform the diagnosis orientation in hospitals, general medicine, medical industry area in both southern and western countries. So the idea is having a low-cost and open-source probe, ultrasound probe, in your pocket, like for mostly for physicians, doctors, nurses, anywhere in the world, to plug to their smartphone or tablet or computer, and being able to explore inside the body. The impact, we imagine three big impacts. First is better access to medical imaging, especially in emerging countries, where they do not have access to any medical imaging system, because the sonograph, as you may know, is quite expensive. It's between 50,000 for a second-hand sonograph, and old and second-hand sonograph until 200,000 euro, or dollars, if you prefer. Then to have faster diagnosis. Because if we imagine having patients going to the doctor start imagining what the problem is, try to put his diagnosis on, and realize that he needs more information, so he sends the patient to the radiologist for an echo, an echo scanner or sonography. And usually that takes like a few hours or a few days, and it could be dangerous for the health of the patient. And with this device, we imagine doing it at the same moment, like during the medical consultation. Then it's the cost reduction, because it's open source hardware, because it's, and I will show you why next. So we made stuff. As you can see, this is our first prototype, made with Chinese soup bowl that we just get from our lunch, with this transducer from a second-hand probe that we bought for $20 on eBay. Some silicone, and this is like a broken pencil. Some cables, some breadboards, a few components, and we had a first signal a few weeks ago for, let's say, except those machines for less than $50 euro. So that's the way we are working. Like we are makers, and sorry, I forgot the servo motor here for €4, I guess. So this is the way we approach the situation. We don't need to be like engineer, high qualified engineer and whatever to try to make something happen. So we did that first, and then we had developed our first kit. We call it this kit Emile for some French joke. So it's the visual of our prototype. So it's a little bit bigger. We have some boards, some like we're using a Red Pitaya, which is an open source board. I don't know if you know this one. We have so the transducer is under the table in the water, and we have like what we call a phantom. It's an object for the transducer to try to recognize what's inside. It's like simulating the body. And then I'll show you our first image. So in a few weeks, with our community, we had our first image corresponding exactly to the phantom inside the water. Just now I'm going to stop on the slide for a minute just to tell you how we organize our work. So we started the project a year ago, in November 2014, by regrouping some people from different backgrounds, doctors, engineers, researchers, makers, curious people. And then we start talking like in an informal way, how can we improve diagnosis orientation? How can we take some old technologies from the 70s, because it's exactly what we are using, and try to make it affordable, accessible, and to create this tool. So step by step, we've been talking all together, and the enthusiasm of the people were like growing up, and finally we decided to launch the project by February this year. With a partner, it's a laboratory, the French university we call UNS. The laboratory is the SATI laboratory, And we started by making our own transducer. And today, like 2 days ago, we made our last test on our own transducer. So usually a transducer is 600 euro, and we made it for less than 40 euro, to give you an idea. The backing, which is the part that you put behind the piezoelectric element to avoid having too much ultrasonic noise, is usually a secret recipe like Coca-Cola. And we made it with glue from the supermarket and a few glass and yeah, absolutely. And we made it by ourselves, testing and testing and testing, and we did it. We acted actually. So this was like our first outcome for the project, and then we used, well, we had just different elements, but now we have this kit that we can actually, that you can find on our wiki, it's ecopen.org, it will give you the address if you're interested in it. This is quite easy to build. On the GitHub you have all the code to be able to get the image from the transducer. So everything is fully open. First of all, the hardware part is free license, and the software part is open source license. I don't know if you understand the difference between those two, but one like free license, like if you make some involvement, you have to republish it, and for the open source, whatever you want. The idea is today we have a few schools, university, hacker spaces, fab labs in France, and now also in Belgium, that are building the kit. And we are working all together now in a decentralized way to improve each module of the kit. So you see the transducer, I told you, this is all the, in red you have all the reception, blue it's the transmitting, green should be the receiving, this is emitting, receiving, transmitting, all the mechanics, and some other issues like battery and board. So this is all the module of the kit that we are all working together to improve, step by step. This one is almost done, and now we're working, this is ongoing. Well, actually everything is ongoing, but we try to improve, especially all those black square stuff to make our own electronic board for the acquisition part. That will be absolutely open source in the end. The way we work is this way. So we have a nice board in our place. I'll show you right after. And usually when people come for workshop, hackathon, or during the week, whenever they want, it's open. We take pictures and they see what we are working on at the moment they arrive. We put the pictures where we want to work. So they stay in the project for until we have an outcome for each one. Global outcome, we have a full wiki with all the information, 9 challenges. For a fully inclusive project, because we also have legal challenges, we also have design challenges, economic challenges, and so on. We have a kit, as I told you. We have like more than 120 people invested in the project, including 1/3 of the health professional. A lot of people, and we're lucky that we're happy having like over than 3,500 students in the project. This is where we are. So it's a nice office. It's a little bit bigger. We have some rooms on the side with an electronic workshop, and we thank the APHP. It's a group of all the hospitals in Paris region. They give us this area, so we are a hacker space here, absolutely here, if you want to know. So this is Notre Dame for those who know Spanish. So we're in the middle of the city. This is the Hôtel du Hospital, one of the, I guess it's the second oldest hospital in Paris, back to the 13th or 14th century. Used to be the place for innovation in health, but not anymore. So we're happy to be here and try to push innovation inside the health care system. Here we go. Thank you.
So if you guys have questions about the
Yeah,
first
for
project.
both for Vire and Mary, who is on Skype right now.
Yeah, I'll bring it up. Maybe can I use this chair so we can sit here somehow?
So first of all, any questions from the audience? Something that you would like to know more about?
this project.
Yep.
Yep.
Yes.
Yeah, so this is towards Byron
This is.
and Mary, I guess.
Hey Mary, can you hear me? Oh, there we go.
Yes.
Alright, cool.
Okay, so you're interested in making estrogen, or having people make estrogen at home? Or yes?
Yes, technically, I guess. We're
Technically.
interested in the idea of what it means if they can.
Okay, okay.
Yeah.
So less about the actual execution of it.
I don't think she can.
Mary, he asked if we're interested in having people make estrogen at home. Oh, and now she just moved. And I said we're interested more in the idea of what happens if people can. So yeah, you can continue.
Yeah, okay, but so it's one thing making it, right? And it's another thing getting it to a pharmaceutical quality that you can actually use it.
Totally.
And the making is probably the much easier bit.
Uh-huh.
So whether you can make it or not, okay, maybe that's interesting philosophically, but maybe also more interesting if it was a real thing that people could then use. And I wonder if you've thought about that stage of it.
Yes. Is it asking about the actual quality of what we're going to be able to make?
Yeah.
So I think that, like, for me personally, I do think that what you're saying. What's that, Mary? Yeah. I'll answer.
I can actually hear the questions.
Oh, okay, good. So I think that, yeah, that's important for sure, like thinking about that in the future. But right now we're just kind of focused on like, what are the actual environmental and social ramifications of something like this existing. So later on, I'm certain that we'll cross that bridge once we can actually make it and then like refine it to a place.
Yeah.
We'll deal with that. But I think as artists, like, you know, as Alan Kay, the wonderful computer scientist, says, the best way to predict the future is to invent it. So we're taking the first step in inventing what we think could be better.
Yeah.
Bill?
Yeah, it's kind of a follow-up question, I guess, because you talked a bit about like esoteric knowledge, and that I guess in some ways you consider this almost satire, in the sense of you're showing this project and you're like, oh, we're solving this, but actually there are social reasons why it's not actually solving it for kind of underprivileged or can you comment a bit about, is that something you're interested in kind of exploring and solving that as well, or have you, what are your thoughts
Actually
on that?
solving it?
Or like, yeah, what would it take in your opinion?
I think it would take a complete, well, especially in the United States, it would take a complete dismantling of the education system and rebuilding it so that like marginalized individuals aren't pushed to the periphery. So it's a way bigger question than. Yeah.
So I guess the question is, do you think that like hacks would work for that, kind of trying to fix the system, or do you think that maybe kind of trying to like kind of making these hacks and presenting these open source things actually kind of obfuscates that there is a bigger problem that is not addressed by those hacks?
I think that's exactly what we're after. Yeah, the latter. Yeah, it just completely muddles the topic. You agree, Mary?
Yeah, I think that in the process of trying to figure out an open source method, we're hacking the science, but also hacking these institutional barriers that are preventing us from reaching a solution in an easy manner or an accessible manner.
Yeah.
Yeah.
We would like to, the course you invite us to with Foucault, Latour, Marx, and so on. So to think of the extent to which hacking is being hacked or will be hacked, and this kind of hacking too.
Mm-hmm.
And then there is a woman, Melinda Cooper, who wrote it really nicely as a critique on the idea of fixing things through hacks, seeing how actually the pharmaceutical companies are finding an interesting model for innovating drugs by borrowing the ideas of opening, outsourcing innovation to users. And basically, and then she shows they have sort of imitated the same innovation process that they flooded the market with drugs, and then they see what happens. And this in this way you discover Viagra, for instance. It's like you know, you see, and then other gets heart failures, and then if that happens, you withdraw the drug. But this way, they have outsourced innovation process, and so, and I can see how the pharmaceuticals like strategy is meeting up with our strategy here, but we have covered it in with pictures and marks and so on. So I would like to have some reflection on that.
Some reflection on that? Sure.
Or
What was her name? I want to write that down.
Melinda Cooper.
Melinda Cooper. That sounds very familiar, but I don't think I've... Melinda Cooper. Well, I think it's interesting that you bring up how they're kind of like co-opting the system, because it's really what they're doing is they're just offsetting liability too.
Yes.
You know, it's just like that's really they don't care. I don't feel like maybe the researchers care about actually finding a solution, but especially in such a profit-driven model as in the United States, that it's just like anything they can do to lower the amount of insurance payouts that they make, or payouts for any kind of like wrongdoing on their part, which constantly happens. So yeah, I think that's an unfortunate side effect of it. As for the future of that, I'm not an overly optimistic person that all this hacking is going to get anywhere, because corporations, like, they are specifically designed to like latch onto, and I'm not calling this all a trend, but to a degree it is like trends in society, not trends in like style or whatever. I'm not trying to diminish it, but latching onto trends and then using them kind of against the people that initiated them, you know? So, I don't know, I guess I'm not nearly as optimistic as most people. Mary, do you have a comment on this?
No, go ahead.
Okay. I don't know how much more I can elaborate. I don't think I'm well suited to making that kind of, prediction at this point. I don't know how to feel about it. I'm deeply worried. I think that's that's all I'll say, is deeply worried, because what happens to people like you guys, you know, you get pushed to the periphery of innovation also, you know, as, and a lot of people will fall by the wayside, like I know I've had a lot of friends that had the best ideals at heart, in terms of like democratizing access to coding or whatever, into technologies, but then they get that nice paycheck from Silicon Valley flashed in front of them, and they're like, screw it, I'm buying a boat and a nice house, and it's gonna be great. And so I think until we can like undermine that model of consumption, then there's enormous roadblocks, you know. I don't know.
I have a question for Olivier. I think the EcoPen story is a really nice success story in the way of how you build up a community to make a tool, an open tool. So, so if you have a group of hackers and a group of makers, what lessons did you learn from this story about how do you actually make it possible? Because sometimes it's easy to get people interested in it, but then to be able to build a tool requires some effort.
So how we build this community?
Yeah.
How we make it?
Yeah,
Like,
and how
well,
for other
actually,
people that would like
it's
to
the
do
first
this
step.
kind of tools. Yeah.
So now we're on the way for the second step, which is the functional prototype, but we're almost there, I guess. So how we build a community? That was actually our biggest challenge, much more than technological challenge. The biggest challenge is more community challenge, how we make all those people collaborate together. Especially because we really wanted to bring all together hackers, makers, students, high-level researcher, head of research department in the CNS, for example, or professor, or just like curious people, as well as doctors, students in medicine, and well, how we bring all those people together first, because we were aligned on the vision, like making all those technology available for the healthcare system, for the health professional. So this is first. I guess this was the idea that bring everyone work together. Then it's not like a pop-up effect. It's something we really worked on. We have been spending a lot of time working, talking with each people, finding what is their own incentive, why they want to come to the project, how we include those people. And it's not the end, because now we will need some new skills, new expertise, so we will have to find ways to bring those people to come to us and to be able to work on this project. And today, for example, we are working on some electronic and signal analysis issues and challenges more than issues. And we start having new profile. Usually they're interesting, especially when they are teachers or professor or researcher. They're interesting because it's in their field. So that's quite easy. But when we start having some companies, like industrial companies, it's the same. It's, okay, come to us. It's more like the vision, I guess. It's more like the vision and the way we organize the work. Like the different steps and, okay, we do that, this and this. And so we know what we're going to do in 3 weeks, 1 month, 2 months, so we have time to mobilize each profile one after the other. But we really need to have, we actually are quite lucky because we are a core team of 5 people, and we are dedicated to this project, part of the project, and this is one of the, I guess, one of the key to success.
I think we have time for another question. Yeah.
Yeah, I was just thinking, towards you, are you confident that you will be able to do like these ultrasound detectors that will be able to do something useful? I mean, with a few, what was it, a few hundred euros, you're
Yeah, that's the idea.
yeah,
Actually, today we can find on the market some what they call the ultra portable ultrasound scanner. It's in between 8,000 to 15,000 euro each, like for one device. Our idea is to divide the price by 15, about 15, so under 500 euro, if possible. But we are not going to build it ourselves. It could be a do-it-yourself product. Like if you have all the information on the wiki, you can build it by yourself. But the problem is that if you use it in a medical environment, who will be responsible if the device is not built properly? Like if the image is not what the image should be. There is, like, it's a little bit on the side, and you do something on someone's body and the guy died. So there is a huge responsibility behind. But the point is, to be open, it will let anyone, like any industrial who is interested in build it, and with the license that we should respect, because we are currently working on finding a sponsor to help us to maintain like the licenses, which is very important for us, but maybe not at the moment, but for the next step. The point is, it's more important for us that anyone, especially in emerging countries, will be able to fix it up. Like, there is something broken inside, they will be able to open it and to replace the piece. Like, if it's a transducer, just need to open it, place another low-cost transducer, and you can reuse your system. And then it's the same today when you have those ultra-portable machines. You have the device, like the display, provided with the probe. So if the display is broken, you have to buy a new one. Like all the system. For us, the idea is to be able to change, and to be able to use it for a long time, and to be able to fix it up when needed. And then there is some regulations, like the CE, the European mark for medical device. This is something we absolutely can address, because we have the right partners at the moment that are working with us on defining how we can manufacture this, and we will work in partnership with the manufacturer. But the most important for this part for us is to keep within the community the group of the people that have been created this probe. We need to first masterize all the technology to be independent when we negotiate with the industry like manufacturer, and to have this group power to say, okay, it's a low-cost probe, so it should stay low-cost probe. Even if the manufacturer should have should make their money, for sure. They have expenses and stuff, but today we are talking with some manufacturers for the next step, and for the moment it's on the right track. And yeah, it's quite interesting. And yeah, it's going to be really low cost. That's our point. Well, I mean low cost as compared as the discussed here. Is that
Yeah, I was just thinking about the, I mean, won't you be sacrificing quality with cheaper sensors and everything like that? Or
okay,
you make a product-
that's a good question. First, we use technology from the 70s. It's a mono-element piezoelectric. So it's an old technology, but with the all the electronic components have been reduced in size those last years because of laptops, smartphones, and the development of those devices. So now we can make it for a cheaper price with the technology that was very expensive, like 30, 40 years ago. This is the first point. Then 30 years ago, they used to do sonography with good quality to get the answer. So why, if you use today those technologies from the past, we're not going to be able to have the same quality. But we know that we're going to have a better quality already. But not the quality of a big machine that they use in hospitals today. But the idea is to help doctors, like health professionals, to orient their diagnosis. So the idea is, okay, you have in your mind, for pneumologists, you imagine, the example we give quite often, if there is water inside, like the
Lungs.
lungs, thank you. Water inside lungs, they just take this probe, they put the probe on the body of the patient, and they see if it's black, there is no problem. If it's white, it means there is water inside. So you don't need to, and it could kill the patient if it's not like taking in charge as fast as maybe but okay, and then yes, no, and you bring to the right service to have to, well, to take care of this issue. So it's more like diagnosis orientation than really having, for example, for pregnancy, it's only to detect if a woman is pregnant or not. It's not like those ultrasound, like those sonography for the first month, third month, and so on. It's just to check yes or no. And if there is a complication in this pregnancy, we also can address issue. And it's what have been done with other devices in Morocco, and they reduce actually the death rate from 20% to 0, and taking the time to address any issues from 2 weeks to 2 hours. So this is also the idea. For example, in this emergency service in a hospital, people arrive, they can just like check rapidly there is an internal emergency or there is any issue, so they can directly send to the right service, and they don't need to ask people to wait, because it's dangerous for them to wait. And so we imagine with some study, we've really studied this question, we imagine being able to reduce by 50% the waiting time and the number of people in the emergency service.
Sorry to interrupt, but I think we have to go now. So if you have more questions, you can ask them later on. And so this afternoon we'll have a session about synthetic biology. We're going to talk about artificial life, bioart, and many different things. So you're welcome to.
And shamanism. Around 6 we will be drinking some algae beer, so if you're interested to
Yeah.
talk about biohacking and shamanism, we'll be happy to have you around.
So thank you very much, and see you this afternoon, hopefully.